Thank you very much to all the distinguished panelists today, to the APHPN, to Dr. Roberts, and to, I think I see 57 participants. So that gives us, I think, roughly 2 per state. So I think we've got a very good national spread. Thank you for inviting me and thank you for joining the Wellbeing Foundation today. It's a very unusual event that we're holding today that also marks International Human Rights Day at the end of the 16 days of activism. And we particularly wanted to hold this event to introduce and to build support for a Wellbeing Foundation Africa developed health worker protocol for recognizing, reporting, referring, and aiding in the reprimanding of victims of sexual and gender-based violence during pregnancy, and also through them to actually reach their families. We all know that the prevalence of physical, emotional, and sexual violence against women and girls, according to UN Women, is 1 in 3 women worldwide, experiencing this mostly by an intimate partner. But last year, before COVID, we actually also know that an estimated 243 million women between the ages of 15 and 19 experienced sexual and/or physical violence by an intimate partner around the world. The research has shown us that pregnancy does not prevent the occurrence of intimate partner violence, because in a 2011 WHO multi-country study, 50% of women stated that they were beaten for the first time during a pregnancy. And studies estimate that in Africa, between 23 to 49% of pregnant women experience physical, sexual, and emotional violence from an intimate partner during their pregnancy. We've also seen from help desks like the DFID, Violence Against Women and Girls Help Desk, which also recently conducted research and established an advisory service. It concluded that early and forced marriage is common in some regions of Nigeria, and those regions are not only in the north, actually. We also have a bit of a problem in, for instance, Ebonyi State. And 67.6% of girls in the northwest, 56.6% of girls in the northeast are said to be married before their 18th birthday. Further, 49% of girls and women aged 15 to 49 years in the southeast and 47.5% of women in the southwest have experienced female genital mutilation, cutting, according to our National Population Commission and ICF International as of 2014. We've recently had an increase in reports of gender-based violence cases in all the 6 geopolitical zones since the pandemic began. The lack of systemic data collection remains a very significant challenge, but the existing data shows a rise in reporting. There was a 56% increase in reports between March and early April in the first 2 weeks of lockdown. And according to the Office of the Vice President, the Federal Capital Territory Sexual Violence Response Team received 107 cases between the 23rd of March and the 30th of May, an average of 13 cases a week, double the 5 to 6 weekly cases received prior to the pandemic. However, we know that our reporting levels are not high. So the true levels of violence cases and incidents across the country will be far more those who report because our women report as a last resort, declared a state of emergency on rape and sexual violence in all the 36 states, and urged the states which have not done so to domesticate the Violence Against Persons Prohibition Act. As of now, we are unsure how many states have actually increased these provisions and their penal code to increase the protection for women and girls. But we do know that our 6th international campaign that takes place every year, we commenced on the 25th of November, and we are actually ending today on the 10th of December on Human Rights Day. So we know that violence against women is one of the most pervasive breaches of human rights worldwide. On the other hand, we also know for those who are public health practitioners and healthcare workers across the country, and her newborns' health and well-being is the most important mandate known to the development world. So this was the point where I said, as Wellbeing Foundation Africa, we must put ourselves in the position of a victim. If we were a victim in Nigeria today, would we really want to report as the first point of reporting to a police station, or would we want to report to where we could get help. And this is where we started to look at the increased need for SARC services transitioning to within hospitals as independent facilities or under the hospital authorities within the hospitals. Until 2019, sexual assault cases were reported either to desk units located within the very police stations that perpetrators are being summoned to, which results in further fear, a lack of confidence for successful convictions. Victims and their families are forced into silent sentences of social stigmatization, police extortion, and very little trust in the judicial process. The result, women remain wary of reporting rape, sexual assault, and cases of violence to their local authorities, and the situation is even worse for children, for minors. Expectant mothers across the continent are finding themselves increasingly oppressed. Recent studies estimate that between 23 to 49% of African pregnant women are actually subject to an act of violence. So this particular outreach is to ask all of you the policy formulations that will make you our sisters and brothers keepers, because this is not confined to women alone, where as policymakers and as healthcare practitioners to take that intentional and deliberate decision to be able to recognize the signs of sexual policy that will help you act and be recognized and respected as forensic witnesses, and to be able to start that reporting structure within the hospital. So I know that it sounds like a simple ask, but I know it really isn't a simple ask. I want to thank who I hope by the end of this particular meeting and then ongoing as we formulate our policy will actually be able to lead Nigeria in formulating a policy that protects every victim, because we know that even when a victim is scared of going to police station, that victim will go to seek medical in producing Nigeria's first guidelines for health practitioners in recognizing, regulating, and referring cases of sexual and gender-based violence, and also acting for us, standing in the breach to reduce the trauma on the victim, and very, very responsive forensic witnesses. I thank you for listening to me, and I wouldn't want to interrupt you any further because I too want to listen to all of you today. So please, I wish us all fruitful deliberations. Thank you very much.